Well, welcome to my makeshift clinic right now. It's
Yeah.
under build out.
Awesome, thanks.
Alex, I just would like you to maybe introduce yourself and tell us who you are.
Sure. Hey guys, my name is Dr. Ace. I'm a naturopathic medical doctor at Regenerative Health Medical Center. And talking here with Matt Zanis, I love movement. I love being strong. I love getting people out of pain. So really wanted to talk with him, kind of banter back and forth about pain. What is it? Why does it manifest? His PT world with pain, my naturopathic side with pain, and where can we go?
I'm Dr. Matt Zanis. I am here actually in my build out right now. We got a nice green screen wall. It's my colors and everything, but it's a process. We were moving through it. Alex was kind enough to come by here and deal with the makeshift right now. But we are going to talk a little about how the physical therapy side of things and her naturopathic side of things really work together to get people out of pain and improve their movement, because we're both on the same page with things. We may go after the same source a little bit differently, maybe different methodological or philosophical standpoint, but we are striving towards the same goal.
Totally.
So I think I would just like start this off by asking Alex what her definition of pain is.
Sure. So for me, I see pain really as a signal. And it's something that really comes from the brain. Sometimes it's appropriate. Sometimes it's telling you, hey, you just jumped off the curve and you tore a ligament. Sometimes it's major trauma, but sometimes it's a signal that's inappropriately elevated, that's trying to warn us, but it's not actually appropriate. So trying to understand really where that's coming from and get to the bottom of it. So to me, I see pain as a signal from the brain.
Good, perfect. I think that's something important to kind of get across too, because you can have actual pathological tissue damage.
Yep.
Cut your finger off, that's going to hurt like hell for some people, but it may not hurt for other people.
Yeah.
Right?
Well, and that's the super cool thing that in talking about pain science is that it's been shown that damage in and of itself doesn't always correlate with pain. Like you can have two cohorts that have horrible disc degeneration on MRI. One cohort has pain, the other one doesn't. So it's like, what's going on
They
there?
could take thousands of us here, even in this gym or out in the streets, MRI, CT scan, X-ray, find all these nasty little pathologies.
Yeah.
Disc herniations, osteophytes, bone spurs, torn menisci in the knee.
Yeah, and they'll be like, from the orthopedic standpoint, it's like, oh, we found a reason for your pain. But really, what I'm looking more into is like, that's a trigger that can exacerbate pain, but really in order to be in a state of significant pain, you have to have central nervous system sensitization. So like you have to have your brain already triggered to enough of a point where whatever else is the straw that breaks the camel's back.
Gotcha.
So
you think it's safe to say that maybe pain is more of a stress response than anything else?
Sure. I mean, I think, at the end of the day, our body's primed for survival. So it's going to do anything that it thinks is going to be consistent with our survival, which is not always consistent with thriving and being pain-free.
Sure.
So it's, if we've experienced pain from doing something in the past, even if what we're doing isn't going to hurt us, there can be that pain signal. Oh, hey, it's not safe for you, but it may be totally fine. So it's worse with stress.
It's a defense mechanism.
Yeah.
Right? So from my standpoint, I'm working with athletes here in the gym or sports strength conditioning.
Yeah.
There may be a movement pattern that somebody's moving that maybe their brain doesn't agree with, or it's sending out a pain signal to try and get them to move differently.
Yeah.
Or get out of that pattern because it may potentially lead to some type of structural damage.
Sure.
On the other hand, though, it could be load, right?
Yeah.
It could be volume. We could be just sitting here, slouched over,
For a long time.
head for a very long time, and the sustained posture of sitting in this position could essentially piss off the brain in a way that it wants you to move, right?
Sure. So overloading, and in that case, physical stress. Yeah.
Do you ever feel like your butt's burning when you're sitting for too long? Like that could be another
like airplane rides.
Right? It's trying to get you to move and get up and get the blood flowing and really start to move the nerves around in a way that kind of desensitizes the body.
Yeah,
right?
or give it another option for how to move that doesn't keep loading the same tissues in the same way and causing that repetitive sensitization.
Right, and then from a movement standpoint again, especially with CrossFit, right? We see a lot of repetitive movement patterns.
Sure.
It may be constantly varied functional movement performed at high intensity, right? But let's think about this.
Yeah.
Constantly varied in what way? It's all in the sagittal plane for the most part. You can do it in a doorway. You can
Sure.
do it inside the rig, squatting, pressing, deadlifting.
Yeah.
So a lot of times people get hurt in CrossFit. It's not necessarily the movement that's wrong. It's that they're just doing too much
Sure.
sagittal plane movement and leaving
Yeah.
out the variety or having varietal movement in like the frontal plane.
Sure.
Right,
So what I'll
transverse
see
plane.
with that as well, to add another component, speaking of CrossFit, is also getting back to the stress thing, the load thing. So when we look at stress overall, getting back to pain being a signal that the body's under stress, is that, you know, in that methodology of training, you have a lot of push, 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 go, 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 without the other lifestyle factors of sleep, nutrition, recovery, hydration, everything that your body needs to handle the stressors. Sure. And then, you know, that's not even taking into account people's stressful jobs or maybe some underlying gut issues or malabsorption. So it's like, yeah, the stress can manifest to a point where even if you don't have tissue damage, it can send a pain signal. So it's so often with chronic pain, to me, it's crucial to get the movement patterns down. It's crucial to get the orthopedic stuff, but then the aspect that people aren't thinking about with pain is, why does it keep going when I've dealt with all those issues?
Goes back to the stress response, right?
Sure.
So two very low-hanging pieces of fruit are sleep and nutrition.
Yeah.
And we know in the literature too that sleep and nutrition are the two most robustly, I guess, researched topics that actually show benefit towards recovery and decreasing the pain response.
Totally.
Right?
And I mean, that was a huge light bulb moment for me in my journey, because I was under chronic pain in a car accident, 7 fractures in my pelvis, pretty messed up, and diet alone decreased my pain by 50%. It was mind-blowing, and that really was my introduction to, wow, there's so much out there that I'm not being told by conventional medicine. Where can I get this information?
Sure.
So it was just, blew me away.
So then you see a lot of this too, I'm sure, in the people that you come across, is about they want the quick fix, the give me it now type of deal for their pain, right?
Yeah.
Is it possible? Can you massage, dry needle, trigger point therapy, cup, smash, inject the pain away?
Yeah. I think it's, you can kind of trick the brain a little bit, and that's where people always ask me, oh, E-stim, is that a really effective therapy? I'm like, it can be in the short term because it sends mechanoreceptors that block the pain signal. But is that going to heal the tissues? Is that going to get rid of the reason for the pain? Is that going to calm down the inflammation? Not really. So
and within chronic pain too, there's really not a lot of inflammation now, right?
Yeah, well, and that's really what I wanted to talk to you about, is chronic pain, because that's something that we both deal with from separate arenas. And myself in isolation, I can only get so much results. Yourself in isolation, so many results. But when we combine the physical in terms of movement patterns and tissue damage with the inflammatory, the hormonal side of things that perpetuate pain, that's key. And I mean, gut issues are the number one thing for the trigger for inflammation.
Yeah, let's get into that. How does the gut influence the brain and maybe the pain response?
Totally. So this is one of my favorite topics.
Good.
So your gut is like your body's barrier, and if the membrane of your digestive tract is not intact, if it's hyperpermeable, you're gonna have proteins and larger molecules that get into your bloodstream essentially, that cause your body's immune system and inflammation to go through the roof. So that's, leaky gut is what I'm talking about. And it's so pervasive because of antibiotic use, alcohol, chronic stress, toxins, not sleeping well, poor, water quality, so many things, that it's an epidemic really. And it's behind so many varied symptoms, but really there is your body's ability to modulate inflammation. Right. So when those molecules come in, your immune system has to be hyperactive, your whole body becomes sensitized. It's the same mechanism for allergies. Like, people think seasonal allergies are just normal. No, your base level of inflammation is so high that it only takes an extra pollen to just blow you up into symptoms.
Send you over the edge.
Yes, exactly.
So then it's pretty much an immune response.
Yes.
Correct? So we know that having high nutrient density, quality foods coming in your system, that lowers the immune response, right? So if you're putting crappy food into the system, your body has to constantly go at it and fight it, which is why you're getting all these external effects from that stimulus, and it can't recover from your workouts, from your exercise. And it's just going to heighten that pain response. So then, I mean, if you look at a histological slide too, you're going to see, like, the nervous system, you're going to see more immunological cells than nervous tissue cells, which is super, super interesting.
So really, yeah, I mean, for me, when I'm looking at pain, I have never seen a patient that has chronic pain that doesn't have some component of gut issue.
Right.
You know, acute pain, I sprained my ankle, that's a totally different scenario, but in the chronic, long-term, greater than 6 weeks, there's always some underlying factor that's keeping the body from actually healing what it otherwise should.
Right.
So.
I think that's perfect.
Awesome.
Yeah, so I think this is a great way to introduce how physical therapy and naturopathic medicine can kind of coincide, because this really is a team event.
Totally.
Right? We're on the same page trying
Yeah.
to get people better. I think it really does take a joint response from
Yeah.
all the medical providers,
Yeah.
right? No matter what the profession is.
Agreed.
So why don't we just maybe go through the top 3 things people can get away, take away from this little talk that we're having,
Sure.
they can implement right away. So for me, I think movement variety is key. Move often, move well. Don't come into this dogmatic fashion where you have to adhere to one methodology. I think getting a variety movement in each and every day and a variety of planes of motion is perfect to keep a healthy nervous system and keep your joints and muscle tissues healthy.
Awesome. I mean, on my end, it's really respecting the body, respecting the natural laws. So you have to have really good nutrition, really good sleep, and really it comes back to the stress response. So balancing your stress, doing things to actively bring down your stress, like deep breathing, meditation, something calming if you have a stressful job, or just knowing that you need to balance that, because if the stress goes up, no matter what else in your life is happening, pain's going to go up and health is going to go down. So respecting the body.
Right?
Yeah.
I can't get away from it.
Yep.
Basic stuff, guys. It's fundamentals.
It is.
Just have to do them well.
Yep.